Diversity and inclusion training for camp counselors. The Hope Mills Parks and Recreation Department is dedicated to providing healthy and fun experiences. Our office is committed to creating a safe space for people of all ages, backgrounds, needs, and abilities. We strive to be welcoming and provide equal opportunities for all to participate. Overview: inclusive language, intellectual disability, communication, behavioral challenges, sensory challenges, physical challenges. So a little about inclusive language. Although different individuals will have different preferences for how to be referred to, it is generally safe to go with person-first language. For example, instead of calling someone difficult, needy, or a problem child, say an individual with sensory needs. Intellectual and developmental disability. Intellectual and developmental disabilities are differences that are usually present at birth and may affect the individual's physical, intellectual, and/or emotional development. This can impact how children communicate, follow directions, pay attention, and play. Children with intellectual and developmental disabilities may need more time to complete tasks and a little extra help or support. Intellectual and developmental disabilities include, but aren't limited to, autism, Down syndrome, cerebral palsy, and ADHD. About 1 in 6 children have a developmental disability, and about 1 in 33 children have an intellectual disability. So, this may be something you come across during camp. Functional communication is forms of behavior that express needs, wants, feelings, and preferences that others can understand. When individuals learn functional communication skills, they are able to express themselves without resorting to challenging behavior or not being able to communicate their needs. Some campers might not communicate through words. Some children use communication devices, gestures, or other ways to communicate their needs. Visual communication strategies, like using pictures, can increase a person's ability to give communication, like requesting a drink, a break, or the restroom, and receive communication, like following directions. Communicating with children who have an intellectual or developmental disability works best when less words are used, communication is simple, and straight to the point. Visual aids can help keep communication simple, such as first, then boards. For example, first circle, then snack, as opposed to, you can't have snack right now because we need to do circle time first, but when circle time is all over, then we can have snack time. To complete tasks, engage in activities, and follow directions, children may require prompting. Many different kinds of prompts can help children succeed. Depending on the activity, try giving the beginning of a word or phrase, showing them by modeling, gesturing, pointing, or mouthing, demonstrating while giving verbal instructions, or touching the wrist, elbow, or shoulder to help a child initiate. You can offer help with hand over hand or say, let's do it together. If a child is still having difficulty after you provide one type of prompt, try a different prompt or a combination of prompts. When a child is doing something that is difficult for them, try using reinforcements to encourage appropriate behavior. Reinforcements should be specific to what the child likes. For example, if a child responds well to social, they might enjoy praise, high fives, hugs, tickles, eye contact, and smiles. Tangible reinforcements include edibles like snacks, iPad, toys, and other preferred items. Reinforcing activities could be jumping, swinging, spinning, or other preferred activities. Here's an example of how to use reinforcements. You notice a child has a hard time staying in the right area during arts and crafts. So you start using a timer to count every 5 minutes the child stays in their designated area for the activity. Every time the child successfully stays in the area for 5 minutes, you give them a smile and a high five and say, "Great job being in your area." Reinforcements increase a behavior, whereas punishments decrease a behavior. Exhaust reinforcements before resulting to punishment. Behavioral challenges. Managing difficult emotions can be very challenging for children and requires a lot of skills that are not yet developed. These big emotions can be increased when a child is nervous or anxious in an unfamiliar environment like summer camp, and they may act out and demonstrate inappropriate behaviors. Many things can contribute to triggering big emotions and inappropriate behaviors. Consider what the child may be experiencing. Are they hungry? Are they tired? Are they anxious? Are they distracted? Assist children in attending to their emotions to understand how they are feeling while also ensuring their safety. You can let a child know it is okay to be upset, but we have to be safe. Transitioning from activities or locations. Some children may have difficulty changing from one activity to the next. To address this, clearly explain the activity, what will follow, and what the child can expect. Include details like the hallways may be loud or the room might feel crowded. Give children a heads up, such as we will be playing outside on the playground for 15 minutes. Then we will go inside and wash our hands for snack time. During the activity, provide times and countdowns, such as we have 5 minutes left before we go inside to wash our hands. When a child seems to be dealing with some big emotions, is having a hard time transitioning from one activity to another activity, or is having a hard time following directions, you can try different strategies to help get them back on track. Strategy number 1. Remain calm. Children will mirror you. It is important to remain calm. Children will mirror your energy and attitude, so make sure you stay cool and collected. Strategy number 2. Provide simple directions. Remain firm in your directions so the child knows exactly what you need from them. Remember, simple language that tells the child what you want them to do is best. Strategy number 3. Use positive language. Tell them what to do rather than what not to do. Use positive language such as walking feet instead of no running, or keep your hands to yourself instead of no hitting. Strategy number 4. Provide frequent breaks. Frequent breaks can be helpful for children who have difficulty paying attention for a long time or have to work extra hard to complete activities, get back on track. Strategy number 5. Change activities or offer other choices. If a child is having a hard time engaging in an activity, offer choices like, would you rather do this activity with a pencil or a marker? Or, would you like to do this sitting or standing up? Keep your directions firm while offering appropriate choices or possible changes within the activity to give the child a sense of control while still listening to you. Remember the levels of behavior and speak with your supervisor if needed. When you see level 1 behaviors such as acting angry, showing frustration negatively, or not listening or cooperating, remember to use your strategies. If you see a child demonstrating these behaviors and are still having difficulty, speak with your program supervisor. Sensory challenges. Children with sensory needs or challenges have different likes and dislikes. Children have different experiences with things like swinging, physical contact, touching certain textures, sights like bright lights, loud sounds, strong tastes, and smells. Some children like or even crave those sensory things, but some children strongly dislike them and will try to avoid it. You can always ask a child what they like or dislike. Strategies for children who like sensory input. For children who like or crave sensory things, it is good to offer opportunities for movement activities, whether indoors or outdoors. During craft activities, it is good to offer different messy opportunities with different textures if possible. A strategy for children who like sensory is to provide them with opportunities to do heavy work tasks that require them to use their muscles, like asking them to help carry supplies for an activity, helping set up or clean up after activities, and even as simple as asking them to hold heavy doors open for everyone to walk through. These tasks can be incorporated throughout the day and in ways that do not single out the child, like having all children participate in the activity and assigning helpers. Other strategies can include offering different seating options like cushions, sitting on a ball, sitting on a mat on the ground, and other seating options available. This might help children that have a hard time sitting still in one place for very long and who crave sensory input be able to engage longer. Fidgets and objects with different textures or sounds can help children get additional touch and sound input that they may be seeking. Another sensory option is having them blow bubbles or blow on pinwheels, or chew on snacks or chewies to give input to the mouth. Strategies for children who dislike sensory input. If it seems like a child is uncomfortable, agitated, or does not like certain sensory input, the first step is to ask the child how they are feeling or what is wrong. Most children know if they don't like loud sounds or messy activities. Listening to the child can help you find different activities that aren't as messy, provide headphones, or allow them to go to a quieter area. Once you start to learn the child's dislikes, you can be more aware of big sensory changes in activities or environment and recognize when you may need to offer help or breaks for the child. Some strategies for children who dislike sensory input include offering noise-canceling headphones for loud areas, providing a visual schedule with words or pictures depending on the age to allow them to know about big changes that they are going to experience. Another tip is to have wipes or allow the child to wash their hands after messy activities. Lastly, it might be a great option to have a calm down corner or an area that is quiet where a child can ask to go when feeling overwhelmed. This is not a place that a child should be sent for punishment, but something that the child requests when needing a break. If you notice a child might be feeling overwhelmed, you can ask the child if they would like to take a moment in the calm down corner. Suggesting this when you notice a child may be experiencing a lot could help prevent inappropriate behaviors. Physical challenges. A physical challenge can impact the way individuals engage in everyday activities. Physical challenges can be caused by a disease, accident, injury, or developmental delay. Some individuals with physical challenges might require adaptive equipment to help them perform day-to-day tasks. Some adaptive equipment that is commonly used to assist with physical challenges are wheelchairs, walkers, walking sticks, and crutches. Individuals with physical challenges might experience difficulty when participating in difficult activities such as long-distance walks, running, pedaling, gripping, or sitting upright unsupported for long periods. Individuals with limited mobility may need additional support when traveling to different recreational sites, participating in activities that require movement, or be given frequent rest breaks. Individuals with physical challenges might require the use of medical equipment such as a walker, wheelchair, cane, or crutches. It is essential to provide a supportive environment to individuals who use this equipment. Some ideas to support individuals with these medical devices can be clearing walkways and aisleways, ensuring pathways are wide enough and comfortable, and safe entry and exit points. Some special considerations for interacting with children who have physical challenges. Always ask before doing. Never lift a child unless you have completed training prior and are comfortable in doing so. Always ask permission from the child first. Some considerations when serving individuals that experience physical challenges could be eliminating time constraints, modifying the demands of the task, providing rest breaks, using lighter equipment, allowing participants to be stationary or have a stationary role within an activity, such as being the scorekeeper or alternative activities. In summary, different participants may need different forms of support from you. Each child is unique. This training is a brief overview and is not all-inclusive. Specific questions and concerns should be directed to your Hope Mills Parks and Recreation Program supervisors. Thank you.